Hi, everybody. Welcome. I see some names that were previous to this meeting. We just had a town hall meeting for business owners with Senator McGuire going over some of the COVID rules and regulations. And I see some of you have jumped from that meeting into this one. That's great. It's good to see you. We appreciate it. So we're going to go ahead and get started. Just a moment here. So hello, everyone. Welcome to this week's community update. If you don't know it by now, I'm Cindy Vosberg, Crescent City Del Norte Chamber of Commerce Director. And as always, I'm very honored to be here with you. Tonight, we'll be hearing updates from Dr. Stutz, our Del Norte County Public Health official, Ellie Popadich with Cedar Coast Hospital, and Jeff Harris, our Superintendent of Del Norte County School District. We have some great news for you at this time tonight. This will be our last scheduled community update as our COVID numbers have decreased enough that Dr. Stutz and the rest of us believe we have weathered the worst of the surge for now. Of course, we'll be watching the numbers and being very observant. And if we need to, we'll schedule more meetings. But at this time, we're not scheduling one for next week. This doesn't mean that we should let our guards down, though. We should continue to mask, social distance, and if we haven't gotten vaccinated yet, please do so. After the updates tonight, we'll have time for a few questions and then get you out to enjoy your Thursday evening. Thank you everyone for being here with us during this time. I feel like we've all bonded and have gotten to know each other just a little bit better. And as you've heard me say before, together we are so much stronger than alone. So let's fight this COVID battle together. With that, let's go to Dr. Stutz.
Hey, Cindy. I'm going to share a little quick PowerPoint with you guys that I'm sure you've all seen before if you've been on our meetings, similar in format. So this would be for the late August through today's date, the data that we have so far. So more good news this week. Our average new cases have again been trending down over the last week, currently at 14.1 cases per day on average, is significantly down from our peak, which was somewhere around 30 or 40 every day, or even higher, I think, on some days. So again, the new cases are trending down, although I would say our hospitalized patients and ICU patients, it looks like I don't have this week's up-to-date data, but if you consider through 9/23, September 23rd, they're just kind of leveling off, which again, I think I mentioned last week and the week prior to that I expected the hospitalizations and even the deaths to level off before they continue to drop, because that stuff generally lags, obviously, for obvious reasons, temporarily, the new cases per day. So our vaccinations are up another percentage point. So we continue to go up by about a percentage point a week. And our partial vaccination rate has again dropped, indicating that the rate of vaccination is dropping. So we're likely to see our vaccination rate become even slower in future weeks. Our testing positivity again last week was down to about 6%, which is a huge improvement over the 18 to 20% that we were seeing during the peak of the surge, but also not where we'd like to see it. I'd like to see it something less than 3% maybe would be ideal. Go on to the next slide here, and just update you on the deaths in the community. So over the last week, we've had 2 deaths. No changes in the data from prior, no incoming deaths from outside the county that we were surprised by. But again, I caution everybody that this data might change depending on if we get information from outside sources about county residents that have died elsewhere that we didn't know about, or if we get any coroner's cases in the community that get determined to be COVID cases as well, that these numbers could change. And the age range here over the last week was 49 to 73. So that's all the data I have for you. I just want to say that, yeah, this will be our last town hall meeting for COVID for the time being, unless we get hit with another surge, in which case we'll probably start the town hall meetings again. I do anticipate the hospitalizations, the new cases to continue going down. The masking mandate, I foresee probably being able to rescind that in a couple of weeks' time. But I'm still going to recommend that people avoid large gatherings and, wear their masks in public and during large gatherings that they do choose to go to, just for safety in this environment, since we don't really know what's going to happen at any given time with these COVID variants. I also wanted to remind everyone that we're coming up on flu season, and there's been some really interesting flu data over the last over the last year, basically, about influenza cases that happened during the COVID pandemic, during 2020 flu season, 2020 to 2021 flu season. We really saw quite reduced numbers of influenza cases nationwide. It was so low that it was the lowest flu season ever recorded since we started counting nationwide. And that probably had something to do with the stay-at-home orders and the masking and the hand washing and everything that was meant to be targeting COVID also worked really well to prevent transmission of influenza. So I want to remind everybody that those things still work for influenza. You can always choose to wear your mask and wash your hands more and not go to that gathering and that sort of thing. You'll be making yourself a lot less likely to get influenza, and also to seek out and obtain an influenza vaccine, which are incredibly effective. They're more traditional vaccines than the newer COVID mRNA vaccines, but they still work really well, depending on the flu season. And so if you want to also protect yourself from another virus that tends to kill human beings fairly frequently, get your flu vaccine as well as your COVID vaccine. I do know that manufacturers are working on combination vaccines. So if your fear of needle sticks is what's getting you, there may be vaccine combinations coming out, such as flu plus COVID plus RSV. I've heard that they're working on polyvalent vaccines for those things, which would be nice. So you can only get one needle stick. That's all I got for you.
That's great, Dr. Stetz. And if you can stop sharing, there we go. So we'll go ahead and go to Ellie.
Hi there, good evening, everyone. Mr. Rear, will you go ahead and pull up the slides? I think they're coming up here. Okay, so we're gonna go ahead and review similar data that you've seen in the last few weeks. And as Dr. Stutz indicated, we are leveling out. If you saw the data he showed, he was looking there around the 17th. And that was a leveling out period. However, I'm happy to share with you that since about the 22nd, we've seen a precipitous decrease in hospitalizations due to COVID. And so that's really great news. I do think we're starting to see that anticipated downward turn now. And so we'll go ahead and go to the next slide. And I will speak a little bit about the overall hospitalizations we've seen in the last almost exactly 2 months. When you count today, we had a total of 100 patients. How it was an exact round number, I can't tell you, but over the last 2 months, we've had 100 patients hospitalized for COVID, unfortunately, 86% of which were unvaccinated. 55% of those were under the age of 65. So as we've been saying, some of our younger population, and in fact, more of our younger population were hospitalized. We had a total of 38 patients who received critical care measures, 88% of which were unvaccinated, and a total of 22 patients that ended up on ventilators, 95% which were unvaccinated. This is probably the best slide of the last few weeks from my personal perspective, and that is because as of yesterday, we are down to 4 patients hospitalized in our community with COVID, which is a really great thing because, as you will recall, in prior weeks, we've had significantly higher numbers, and even more positive than that, we have no patients on ventilators at this time. Of those patients that are hospitalized, none of them have been vaccinated. So this is the right direction as far as patients needing acute care. and not being ventilated, we do want to still continue vaccinations though, because there are still patients out there, individuals in our community who are not vaccinated, and we hope that they're not coming to the facility to be hospitalized because they're getting sick. So this is good news here. The next slide speaks to our deaths. Unfortunately, over the past 2 months, we've had 23 members of our community pass away due to COVID. 91% of them were unvaccinated. And lastly, I want to remind everybody about the vaccine clinics, the drive-to testing, and the monoclonal antibody treatments. These are still available Monday through Saturday, 9 to 6 for everything except for testing. It ends a little bit early at 5:50. Each day appointments are not necessary for vaccinations or drive-to testing. The vaccine clinic also does offer the booster for those who are eligible. So I know some people have been asking about that as well. There are also other testing and vaccine clinics throughout the community. These are not the only ones. I can't encourage folks enough to get vaccinated. And if you do end up testing positive for COVID, and or you have had very close encounters with somebody who's positive, please reach out and call for an appointment at this 707-464-8954 number. They will do a screening, a clinical screening on whether you are eligible for monoclonal antibody treatment. We are seeing a lot of positive outcomes for individuals who receive that treatment. They are getting better and not getting hospitalized. So again, that's really what I have for everybody this evening. It's good news, I think. So keep up the good work, continue getting vaccinated and socially distancing.
That's wonderful, Ellie. I think it is wonderful news. And we're going to go ahead and turn now to Mr. Harris for an update from him. Thank you, Mr. Harris.
Oh, I was muted. All right, thank you. I just want to be very quick tonight. Just want to remind folks that they can go to our website, click on COVID-19, Family Resources, and here you can click the COVID dashboard and see what our current numbers are as of last Tuesday. Again, we update this every Tuesday afternoon. As of this past Tuesday, we had currently 13 students who are positive and out on quarantine. We had 2 staff members. There also, I want to point people to this particular link. This is the K-12 Q&A and guidance that we are going by as a school. And last Wednesday, there was an update to this. And basically this Q&A added some issues or added some answers to some questions that we get pretty consistently. FAQs 12 through 16, I think, are probably the ones that people could go back and review if they wanted to. These particular FAQs do talk about students who have been previously diagnosed with COVID-19. And one thing I want to really remind families is if we do not have documentation that your child was previously diagnosed with COVID-19, they will not be eligible for this basically 90-day quarantine waiver. So we have to have that documentation. We also get a lot of questions about contact tracing during a recess. How are we dealing with students at recess? CDPH at this point is not recommending that we contact trace at recess. So that's item 13. 14 gets into sports. Again, I know we've had some questions on here about why does my child not have to wear a mask while they're participating in an athletic event, but they have to wear them on the sidelines. That's addressed here. And then we did have a question I think it was last week, about how can it be healthy for a child to be wearing a wet mask? Well, I mentioned at the time that we have masks available for students. All they have to do is either ask, a teacher has to recognize it, a staff member has to recognize it, and we can hand them a new one. We have cloth masks, we have surgical masks. And again, that's answered here as well. There are 2 other questions that were added, such as poor air quality during wildfires. We're not dealing with that at this point in time. And also school closures. But fortunately, as both Dr. Stutz and Ellie have said, our case numbers are down significantly as a community, and our case numbers in schools have never been high enough for us to consider actually closing schools. So that's where we are today, Cindy.
That's another great report. Thank you, Mr. Harris. So we're going to go into some Q&A. And Ellie, although I told you I didn't have any for you that had been pre-submitted, we've had a couple that have come in since this started. And so I'm going to go ahead and start with you. And so we have two questions for you. One is, someone heard a rumor that Sutter is now charging a copay for testing. Is this true?
So it's kind of a catch-22 question. And the reason I say that is if a patient comes into the emergency room for treatment, they're going to be tested and their insurance dictates how some of that works. So that could be true if it's part of an overall care perspective. If they're going through the drive-through, those are initially billed to their insurances. If it's a person who's uninsured, then no, they're not being charged.
Okay, great. Thank you very much. And the other one is, will surgery and non-emergency treatment be resumed?
You know what, that's a great question, and I'm glad it was asked because actually we have begun surgeries, and I should have added that earlier on. So thank you to whoever asked that question. We are now resuming and have resumed elective case surgeries. So many patients who were waiting and who had been postponed, we've begun to start calling them and bringing them back in. So yes.
Wonderful, great. Melody, I have a question for you. It's actually something I'd like you to share with the community, and that is about the COVID testing at the Cultural Center. I believe that you're probably the one that can share the most about where that location is going to be.
Sure. So OptumServe has been with us for several months now, located down at Kidstown at the Front Street Park, and they're going to be moving about 1,000 feet away. It's not very far at all, over to the Cultural Center so that they can have some, be under the overhang and receive some shelter from rainy weather. So the schedule's not going to change. They test on Monday, Thursday, Friday, and Saturday here in Crescent City, starting at 9 o'clock, and it goes through to 4 o'clock. And then they are in Smith River on Tuesday, same hours, and Klamath on Wednesdays. So it's just a slight change in location so that they can receive some shelter. And then as Ellie has shared with us, there's continued testing that goes on through the hospital. And then pharmacies are also providing some testing. And I don't have a complete update on what's provided through the pharmacies. The testing at OptumServe is PCR. It is not a rapid test, and that test would have to be sent out. And it is available completely free of charge.
Great, thank you so much. And so at the Cultural Center, which is at 1001 Front Street, you would actually go in under the overhang drive-through. And from what I understand, this will start tomorrow, that location, and they will set their van up on the other side of the overhang. And so you'll just drive through and be able to be tested and continue going. Is that right, Melody?
I think they're planning on having it to be walk up.
Walk up, okay. All right, so we will not be closing the driveway through for the visitor center. Last spring when we had the testing there, we actually closed it off and had our visitors parking on the street. We won't need to do that with the way that the city is in. Mr. Weir explained it to me that it should be able to do both functions just fine. And we'll take that as the case by case. If we do need to close off any parking for the testing, we'll determine that at that point. Otherwise, all services for both the testing and the visitor center will remain open and accessible. Right, Mr. Weir?
Yes, that's correct. All those components that you both talked about are true. The other thing that we did last year is we closed Play Street and everybody needed to sort of loop around by the pool. That will not be the case this year. As OptumServe has been really efficient in their testing. It's been quick, so we don't anticipate having a traffic issue. So you should just be able to pull right up, get out of your car. The testing takes about 5 minutes, and then everyone can be on their way.
Right, and they're self-contained, so they won't actually have to be inside the cultural center. So thank you very much. So we do have some questions that have been submitted for Dr. Stutz. And are you ready, Dr. Stutz?
I'm ready.
So we're going to go back to conversation about boosters. Will we be notified when to get a booster if we have already been fully vaccinated in Del Norte County, or do we need to register again?
No, this is going to be on you to figure out if you when you got your original series of shots and if you'd like to get a booster. We're going to be planning probably some booster some booster point distributions. And clinics and hospitals are probably going to be providing those as well. But it's kind of up to you as a patient to take some agency and find out if you qualify, if you want it, and to make an appointment.
Great, thank you very much. So the next question, and we're going to stay with you, Dr. Stutz, is I'm just wondering, based on statistics, is there any way to tell how long this pandemic could potentially last with people not getting vaccinated?
Yeah, I think it depends on your definition of when the pandemic ends, quote unquote. So I think that COVID is here to stay, and that without magically achieving 100% vaccination, which we're obviously not going to be able to do, we're not going to be able to eradicate it from the population. And I also think that even if we were able to obtain 100% vaccination rates somehow in populations around the world, it may not be one of those viruses that we can eradicate. So I think it's here to stay endemically, at least for the time being, which means that our definition of when the pandemic's over could be up to your philosophical interpretation. I personally think that the pandemic is over when hospitals stop being overwhelmed, when it stops interfering with our everyday activities, going to school, going to work, that sort of a thing. And when we've achieved as much vaccination rate as we could possibly squeeze out of the community, that's when it's over for me. And so that would be reflected in how I approach the situation. So that might be different for some people. Maybe some people don't want to see the infection rates and the death rates, the morbidity and mortality that we're seeing, even if the hospitals aren't being overwhelmed, even if our schools aren't being a huge source of transmission, and and our daily activities aren't being interfered with. For some people, it's enough that just being compelled to wear masks is interfering enough that the pandemic isn't over for them. So it's going to be up to all of us to kind of decide where that line is. But for me, those are my criteria.
Thank you very much. Mr. Harris, I have a question for you that's come in, and it says, our numbers are looking good. When can our kids discontinue the mask at school? At the very least, outdoors. This should be a parental decision, not mandated at this point.
So based on where we are right now, neither CDC nor CDPH, and in fact, Dr. Stutz's orders also don't require masking outdoors. As of Monday, we're going to strongly encourage masking, but that will be a parental decision. And we will be asking kids to mask, but it's not, again, we're not disciplining for it. And we won't be sending students indoors if they're not. As far as indoors masking, that is CDPH, and that is standing mandatory guidance from the state. And so until the state changes their masking guidelines, there will be masking indoors at all school and school functions.
Thank you very much. So we're going to go ahead and go back to Dr. Stutz. And Dr. Stutz, so this is, I have a question related to a statement you made before the Del Norte County Board of Supervisors on Tuesday. You mentioned working with the coroner to better communicate COVID deaths to the community, as well as clarifying how the coroner classifies COVID and non-COVID deaths. I'm curious about the procedure for classifying a COVID death, especially since last week you mentioned that you were questioning whether one reported COVID death was actually a COVID death.
Yeah, this is a really great question. And I think the answer will highlight for people exactly how much of a gray area we deal with in medicine in general, and with all of this hard data that we're showing you guys. There's still opportunity for interpretation. For example, so we the county coroner because there are some community deaths that are probably very likely COVID related, and I just wanted to know better how they classify a COVID death. If we don't have, in the event that we don't have any other hard evidence that the patient died of COVID, for example, They didn't have a positive COVID test, maybe, or we don't have a chest X-ray that looks like COVID, or we don't have a diagnosis from a physician that says that they suspected the patient had COVID before they died. Maybe the timeline was different, and they had COVID a month ago, and they died, a month later. Do we call that COVID or not? Well, I mean, a lot of these cases is very difficult, and the process that the coroner uses is a pretty specific process that involves, interviewing the family or the friends of the decedent, interviewing the police officers that may have been on scene when they found the body, and then researching the actual medical history of the decedent if they're able to find it. And then making a determination, which oftentimes is a judgment call based on the collation of data that they've gathered. And it's the same way for me in the hospital or in public health and I do this several times a week now, looking at a community death or a hospital death and trying to decide, well, should we really call this a COVID death? Because sometimes it's not so clear. We don't have any hard evidence, like evidence that I just mentioned. And so sometimes it's a judgment call. Like we would say, like, for example, we had a case recently, let's see, somebody was found at home. They never had a positive COVID test. We never got any report that they had any COVID-like symptoms. But we found out that all of the family members that they had been living with were COVID positive. And let's say that person, didn't have any significant medical history, had no other good reason to have died. And they died 2 weeks after maybe a family member got a positive COVID test. So it's suspicious for COVID. And in that case, I might call it a COVID death. And the coroner might also, if it's found, in the community before they ever get to the hospital. So in a lot of cases, I would say, have these criteria in mind. And the more evidence I see, the more likely I am to call it a COVID death. And same goes for the coroner. The more evidence that they see, the more boxes they can check, the more likely they are to call it a COVID death.
Thank you. That's a very good answer, very complete answer. So then I want to go to a couple questions have come in both previously and during this meeting. Can you please talk about the fact that if somebody has a Pfizer or Moderna vaccine, and we know that Pfizer has been approved for the booster, what do people do if they have the Moderna vaccine? And is the booster the same thing as the initial vaccines that we got?
Yeah, those are all great questions. So the boosters that are being advocated right now, which is really only Pfizer that's been approved, right? They are the same shot that you received when you got your first series. It's a re-exposure to the same antigen, the same viral proteins, right, that you received the first go around. That may not be true next year. There are other actual, like version 2 COVID vaccines that are on the horizon that are actually polyvalent vaccines that cover many different variants of COVID. Like you might in the future be able to get a vaccine that covers Delta and Mu and all of these other COVID variants that we're seeing. And so right now, it's the same shot that you got before, just to re-expose your immune system and remind it to keep fighting against COVID. But maybe next year, well, probably next year, any vaccine that you get that's COVID related might be different. And it might be one of those, I suspect it will be one of those situations where like tetanus or influenza, where we just probably have to get regular vaccines maybe once a year, or in the case of tetanus, once every 5 or 10 years. And so if you're in the camp of people that had the Moderna vaccine and you technically don't qualify for a booster yet, all you got to probably do is wait a few weeks, and we'll probably see an approval for a Moderna booster as well. Is there a value in getting a booster shot of the other brand of vaccine? Nobody really knows the answer to that question because the data is not out there. But I wouldn't fault a provider, a physician, or your primary care physician for choosing to give you a booster with the alternate brand. physicians are, in my mind, are free to make that decision on their own based on whether they think it will help or not. My inclination, my feeling is that it probably will help. And Moderna, the data will probably show that a booster of Moderna does help prevent, future infection with COVID. So, and I think that the data will also show that getting vaccinated with the other brand than the one they originally got vaccinated with will probably also help too. So in my mind, I'm not too fussed about people getting the opposite brand or one or another.
Sorry, I have a dog in the background, so I'm muting myself in between because I'm not sure if he's going to want to join our meeting or not. So please excuse me on that. But we have a question that's in the chat box that I do want to read. I think this might actually be for the city. I'm not 100% sure, but we have both Mayor Pro Tem Inscore and Eric here. So with the reduction in cases and hospitalizations, are you still going to require mandatory testing? If so, how long? That is mandatory daily testing. So I'm thinking that might apply to the issue that was at your city council meeting a couple weeks ago.
Sure, Mayor Pro Tem, if I can just address it from a technical standpoint, and then if you want to weigh in, absolutely feel free. So the city's policy right now is weekly testing of our employees, and it's really just designed to be during this surge. And so what we are doing right now is we are in continuous conversation with Dr. Stutz, evaluating the situation. I touch base with Dr. Stutz every week on Monday. And when he feels that we can relax this policy that we have, then we will relax the policy. And that's sort of been the direction that we've received from the council. To quote Dr. Stutz, I believe at our council meeting when we were first discussing this, his statement was that this policy of requiring testing can be viewed as extreme, but the situation that we were in as a county, as a community, was also extreme. And so having a policy like this to meet the current conditions that we were facing was something that the city wanted to do. Mayor Pro Tem.
Everything that Mr. Weir just said is correct, and I would also just add that this will not be something that would require coming back for the council to take action. We've provided the authority to our city manager, to Mr. Weir, in consultation with Dr. Stutz, that if they were to have that conversation on Monday and Dr. Stutz was to say, I do not believe that the city needs to continue with its mandatory weekly testing, Mr. Weir will have the authority to go ahead and make that adjustment. And we will simply put this in the toolbox. And if we find ourselves in another extreme situation, we will once again consult with our public health officer and have that available. But we can make that change just as soon as public health can give us that guidance, and Mr. Weir will have the authority to make that change immediately. So it's a great question. I appreciate it.
Great. Thank you very much. So at this time, we don't have any more questions from our attendees. Would any of our panelists like to make any comments?
Cindy, if I can, this is the sixth town hall briefing that we have had in a row every Thursday at 6 o'clock, trying to inform the community of our current situation. So I just want to say a sincere thank you to all of our panelists. Ellie Popovic with Sutter Coast, Mitch Hanna has been here telling us exactly what's going on. Jeff Harris with the school situation. I know as a parent, that information is critical for understanding of what's going to happen, how it's going to be treated in just such an uncertain time, right? There's just so many questions. So having that availability, and then to Dr. Stutz, and public health and Melody, but Dr. Stutz coming in as our new public health official right in the middle of this search. I mean, talk about jumping into the fire when a community really needed somebody like him, and his ability to relate to the community, to answer questions, honestly. I can't thank him enough, as well as really all the doctors and nurses at Sutter Coast. What a time to be a doctor or a nurse, to be able to treat families, but see the patients day in and day out. Just a sincere thank you to everyone that has been involved during this time for our community. And then lastly, the community itself, right? we are doing what we need to do. We are seeing these numbers come down. We're seeing our vaccination rates go up, and that's how we're going to get through this. It's going to be together is how we get through it. And so just from my standpoint, and you know, I know I talked to Mayor Pro Tem a lot, you know, the mayor, council members, I know we all share the same opinion that we are all in this together, and just sincere thank you.
So, you know, Eric, I want to back that up. I said in my opening remarks that I felt that through this, you know, crisis, that I feel more bonded to this community. And I see the names of the attendees, and I've seen many of you here every single week. And I feel that you've become, you know, my friends. You've always been my neighbors because we're such a small community. But I feel really bonded with all of you. And it's, you know, we need each other to get through this. I think about, you know, the wonderful family that is running Weir's Mortuary now, and what they and their employees have been through during these last few weeks, and how hard it's been on them. And I hope that, you know, as the deaths have lessened, that the trauma that they too have gone through with taking care of our loved ones, and not only our loved ones that they take care of, but the families of those loved ones, and the effort that they put out to help those families through this difficult time. So I hope that it's become more bearable and a little more manageable for them as well. And so I want to thank all of you for coming and being here with us. And maybe when we can, you know, get to a point where the pandemic has reached a point where we can do the gatherings and stuff, that we have one heck of a party in this community. And on a Thursday night at, you know, 6 o'clock, and we can all raise a glass, whether it's soda or alcohol, and have something to eat together and celebrate that we made it through. So thank you all very, very much. Thank you to all of our panelists. I've definitely gotten to know all of you a great deal more as well. And I'm really glad that I won't be here next Thursday night. So thank you. Mayor Pro Tem, did you have anything to add?
You're on mute, Blake.
I would be the guy that unmuted. I did just notice in our attendees, Cindy, that we did have one hand raised. I don't know if we still have a few minutes that maybe we might take Mario's question or comment before we close off.
Absolutely, absolutely, Mario. So Mr. Weir will unmute you there.
And I'm gonna, okay, can you guys hear me?
Yes.
We can.
Okay, first time doing Zoom here, so excuse me. Yeah, thanks for taking my comment. Thanks for, you know, putting in the time here to inform the public. I wanted to kind of address what Dr. Stutz was talking about earlier, you know, as far as, you know, death count and identifying, you know, the, you know, as it is kind of difficult to actually put a finger on, hey, is this a COVID death? Is this not a COVID death? A lot of it is COVID related. You know, there's a lot of comorbidities that are playing in hand here. And I hear a lot about, you know, the death count of, you know, so many COVID deaths and hospitalization. And obviously, you know, the hospitals aren't designed to handle a surge. There is a surge of patients going on. And obviously we're seeing it's coming down. But I think what's being neglected to make the public aware of is the overall death count rate. And what I have done is I pulled the numbers from 2017 on through August of 2021. And that's in cooperation with the California Department of Public Health and our own county numbers, because the latest ones weren't available from the California state. So, you know, we're not having any change in, you know, in overall death counts. So the average death rate for 2017 in Del Norte County was 26, in 28, 21, and this is per month. Okay, this is the average death count per month. 2017 it was 26, 2018 it was 21, 2019 when the pandemic started it's 25, and so 2020 24, and as of August for 2021 it's been 24. So not to minimize anybody's death, okay, and obviously there are people dying that are COVID related deaths, but I think what's important to let the public in Del Norte County also know that our overall death rate is not skyrocketing. It's exactly the same. It's, you know, the numbers are the same. Now, you know, we always have upswings and downswings in deaths, and, you know, sometimes it's, you know, due to seasonal, but overall, throughout the pandemic, through 2019, 2020, and 2021, our monthly death rate average has not skyrocketed, doubled, or anything like that. And I think that's kind of important to let the public know, because all we're hearing is about, oh, COVID deaths count and cases. And cases is one thing. People do get dead. I mean, people do get sick. And yes, the hospital is impacted, the community is impacted, but we're not having this enormous death count that's skyrocketing. And I think that's very important that people know that.
Oh, thank you, Mario. Thank you very much for your comments. And we actually do have one other question that came in that I think we should take. And that is, so this is, we actually have two. One is, please talk about help with long haulers. Dr. Stutz, I think that would go to you. And then that's going to be followed with one more question, which is, what can you say to a family member who won't get vaccinated?
Yeah, those are both very good questions, and a good previous comment as well. Long-haul syndrome, I mean, it's really incompletely understood. Obviously, we're still kind of, waiting for studies to describe the mechanism behind COVID long-haul syndrome and what we might be able to do about it, how we might be able to intervene. And so I think the jury's still out on what it is exactly, and what we can expect for people who do have those symptoms. There's a lot of attention on it right now. And I feel pretty confident in the next year or two, we'll know a lot more about how to prevent it, medications or treatments, or does the vaccine prevent you from developing long haul syndrome? We don't really know the answer to any of these questions. So it's just kind of something we have to wait for the medical community to provide some more data about. And right now, at least if you're thinking you're experiencing post COVID long haul type symptoms, there are a few academic clinics in the state. I think at some of the UC center, medical centers and elsewhere, where you might be able to get in as a patient to be seen by people who are probably specialized in COVID long haul syndrome at some point, once they've seen enough patients. And so it'd be good to seek out those clinics if you are experiencing those symptoms, and maybe even become part of an academic study about long haul syndrome. So I would encourage seeking out that help if you can find it online. You can find a number of clinics that specialize in this already, I think, usually academic centers. The other question, what should you say to somebody, friend, loved one, family member, otherwise, who you care about and refuses to get a vaccine? Well, I mean, there's been a lot of data actually gathered on how to talk to people who just refuse to get their vaccine, and when they're expressing. So I can give you a few key ways to talk with loved ones, and the way that I talk with patients who are resisting accepting the vaccine. So one of those things is to just listen to them and their concerns and take them seriously. In their mind, there are some things, and maybe sometimes they're having a hard time verbalizing it, that are keeping them from wanting to get the vaccine. And sometimes, and it's your job to try and figure out, basically, if they want to talk about what their reasons are, or if they even know what they are, but also to just accept them as valid reasons. Just because the reason sounds ridiculous to you does not mean that it's a ridiculous reason for not getting the vaccine. That's the way people's brains work. Every person's brain works different from every other person's brain, and what's logical and makes sense to you is not going to make sense and not be logical to any other person in the same way. It's going to be completely different for every other person on earth. So you just have to accept that as face value, and and try to be as understanding as you can, even if their reason to you sounds completely ridiculous. And I can assure you many, many of them do sound completely ridiculous, but it's trying to do it in a non-judgmental way. And so listening to them, and accepting their reasons, whatever they are. And then I think rather than focusing on the hard data, you're going to be less likely to end up in the hospital. You're going to be less likely to die, transmit it to other people. It's usually better to approach them in an emotional intelligence sort of way. Maybe not, if you don't want to do it for you, if you're not concerned about it, do it for me because I'm worried about you. Do it for your children because they're worried about you, or we want you to be around as long as possible. It's for us. It's not for some abstract data point, because we just think that you might be less likely. It's because we believe in it and it's important to us, and you care what we think, and that's why you're part of our family, right? That's why you're a friend of mine. So those sorts of things are good approaches to take with patients. And then if they just absolutely are adamant that they do not want it, just accept the fact that that's their choice, and maybe there's nothing that you can say, or maybe you can keep trying, and just try to keep an open mind that it's good to be a skeptic in this world as well. We've seen a number of we all have examples of medical stories and things in the medical community that have happened where people were not honest actors, bad doctors, incompetent people working in the medical field, medical malpractice that's egregious, or drugs that just don't work and are really expensive and are pushed on to society, such as the opioid drug crisis. I don't know if anyone's watching any of the documentaries on the opioid crisis, the 90s and early 2000s, but that was the medical community in earnest, trying to do something good for people, but ended up getting people hooked on really powerful drugs, right? So you got to accept when people are skeptical of new medical therapies. I'm a skeptic too, so that's something to keep in mind, and to talk with them, with whoever this person is that you're trying to convince. Accept the fact that they're doing it as a self-protective mechanism, and there's something to be said for that too. These are new vaccines. We don't exactly know all the ways that they work. There is real risk to the vaccine, right? There have been a number of side effects. It just happens to be that risk is very low compared to actually contracting COVID. So yeah, those are all the things that I would say about how to talk to people about the vaccine. Keep an open mind. Accept their hesitancy for what it is, and try to come at them as from an emotional angle rather than a data angle. There's also a really, really good series of I guess it's video educational videos by it was an FBI negotiator, a hostage negotiator, and that I would recommend if you can find those videos about how to talk to a terrorist or somebody who's taken hostages. Those techniques are really great ways to talk to people who are hesitant to get the vaccine.
I would have never guessed that. So I would like to thank everybody again. We're going to wrap this up. Mario, I want to commend you on tackling and conquering Zoom, and the comments that you shared with us. Thank you very much. And everybody, please stay healthy and stay safe. Good night.